My name is Trixie Riva, a first-year nursing student. So today, what I am going to do is to demonstrate on how to measure a blood pressure. So blood measurement is performed during the physical examination at initial assessment and also as part of routine vital signs assessment. So firstly, we're going to prepare or assemble all the equipments that we need. So the equipments that we need are stethoscope, sphygmomanometer, alcohol swabs, and gloves if required. So let us gather the stethoscope and the sphygmomanometer to the client's bedside. The rationale behind is to facilitate organized assessment and measurement. Next is to identify the client and explain the procedure to them. So good day, sir. I am Trixie and I am your assigners for today. So can I just check for your name and age, please?
I am Henry and 40 years old.
Okay, Sir Henry, nice to meet you. So what I am going to do is that I will be measuring your blood pressure. So this will entail me to put the cuff and inflating the arm and listening and feeling your pulse. So does that sound okay?
It's
And
okay.
next, it is very important to perform hand hygiene. So the rationale behind this is that to reduce the transmission of microorganisms. So I'm gonna provide your privacy by making sure that all the curtains surrounding us are closed. The rationale behind is that it prevents and decreases embarrassment. So assist the client in assuming a comfortable position, either sitting or lying position. And with the forearm supported at the heart level. So I have a pillow here. So in order to align the forearm of the patient to the heart level, we can use a pillow. So sir, can I put your hand?
Yeah, okay.
So as you can see, the patient's forearm is now on the heart level. And with palms facing upward. The rationale behind is that the blood pressure increases if the arm is below the level of the heart and decreases when the arm is above the level of the heart. Now expose the upper arm and locate the brachial artery. Using 3 fingers, middle, index, and ring finger. Apply the center of the bladder directly over the artery. Wrap the deflated cuff around the upper arm approximately midway on the arm or 1 inch above the antecubital space. The rationale behind is that it ensures even pressure distribution over the brachial artery. Rolling up the sleeve may form a tourniquet around upper arm. Always use a bare arm. If this would be an initial examination, perform a preliminary palpatory determination systolic pressure. The rationale behind is that the palpatory method provides the necessary preliminary approximation of systolic pressure to ensure an accurate reading. Palpate the brachial artery by pressing gently with 3 fingers. Locate the area of strongest pulsation. And now close the valve. Pump the cuff until you cannot feel the brachial pulse. Note the pressure on the sphygmomanometer where the pulse is no longer left. Release pressure completely and wait for 1 to 2 minutes before taking further measurement. The rationale behind is to prevent ear leaks during inflation. Ensures the cuff is inflated to a pressure greater than the client's systolic pressure. So next is to cleanse the earpiece of the stethoscope using an alcohol swab. So after cleansing the earpiece, so we're going to insert the earpiece of the stethoscope into ears. The rationale behind is that it decreases the transmission of microorganisms from one health practitioner to other. So now we are going to place the amplifier of the stethoscope to the brachial pulse. And then hold the diaphragm with the thumb and index fingers. The rationale behind is that sound is best heard directly over artery. Hold the rubber bulb with the palm of the other hand and thumb screw between the thumb and the fingers. Then close the valve. Pump the cuff and quickly inflate the cuff until mercury or needle. The rationale behind is to prevent air leaks during inflation. Ensures the cuff is inflated to a pressure greater than the client's systolic pressure. Release the valve on the cuff carefully and allow air to escape slowly, allowing gauge to drop 2 to 3 mm per mercury per heartbeat. The rationale behind is that it maintains constant release of pressure to ensure hearing first systolic sound. As the pressure falls, identify in the manometer reading Krotkoff phases 1, 4, and 5.
Korotkov sounds or K sounds are the tapping sounds heard with a stethoscope as the cuff is gradually deflated.
The rationale behind is to identify the manometer readings for each of the 5 phases. Deflate the cuff rapidly and completely. The rationale behind is that it prevents arterial occlusion and client discomfort from numbness or tingling. So if you are in doubt in reading, you should wait about 1 to 2 minutes between readings to allow a normal blood circulation to return before inflating the cuff again. The rationale behind is to ensure accurate measurement. And then remove the cuff and prepare for storage. The rationale behind is that it releases the trapped blood in the vessels. So next is to cleanse the earpiece of the stethoscope. And then store equipment. The rationale behind is that it decreases the transmission of microorganisms from one health practitioner to other and fosters maintenance of equipment. Next is to perform post-hand hygiene. So the rationale behind is that it reduces the transmission of microorganisms. So sir, your blood pressure is 100/70, which is normal. And lastly is to record the blood pressure at the time it was taken. So the rationale behind this is that to ensure accuracy. So this is on how to take or measure the blood pressure of the patient. So again, this is Trixie, your first year nursing student. Thank you so much for watching.